everyone, and welcome to week 7. This week, we'll be covering healthcare delivery in the United States and community and public health and the environment. The objectives for this week are you will be able to define the healthcare system, identify some of the major concerns with our healthcare system. You will be able to describe the purpose and concept of health insurance and the terms that go along with that, the different types of health insurance, and then we'll move on to environmental concerns. You will be able to discuss the different types of indoor air pollutants, what type of pollutants threaten the safety of our drinking water. We'll talk a little bit about waterborne disease outbreaks, foodborne disease outbreaks, discuss hazardous waste and give examples, and interpret the relationship between population growth and health. There are 4 items due this week. You will have your climate change assignment, the Affordable Care Act assignment, quiz on chapters 13 and 14, and of course the discussion board. I'll briefly go over the climate change assignment with you. As you can see, the purpose of it is to provide you with an opportunity to research factors related to climate change. Particularly, I would like you to research both sides of the spectrum. Is climate change human-made or is it a natural phenomenon? I've provided some websites you can use to help you research your topic. And for the worksheet, what you will do is list several items on each side of the case. And at the end, I'd like you to write a summary about which side you support and why. The second assignment is the Affordable Care Act assignment. And the purpose of this is to help give you some practice in learning about the different healthcare options. So again, you'll go to the website provided here, fill in some information, and choose a plan to discuss. As you can see, there are 7 questions here that will be related to the plan that you discuss. Here we move on to chapter 13. So the healthcare delivery in the US is quite different from other developed countries. We have a vast variety of options for health insurance and care, and it's paid for in a variety of different ways. In the 1990s is when we really saw the introduction of managed care. And the purpose of this was to help achieve more healthcare delivery efficiency, to control utilization, so who is using the healthcare services, and to help determine prices and payments. In the mid-1990s, the percentage of our gross domestic product in dollars spent on healthcare continued to increase, and they continue to increase to this day. So we have a spectrum of different healthcare delivery options with various types of care, various types of healthcare providers, and various types of facilities in which healthcare is delivered. Think about it, you can go to private practices, you can go to clinics such as Walgreens or CVS, you can go to hospitals, emergency rooms, immediate care centers. So we have a vast variety of places we can go to obtain healthcare needs. When we look at public health practices, these are really interventions aimed at disease prevention, health promotion, and specific protection and case findings. A lot of this involves health education. So educating our public, empowering the public, and motivating the public to make better healthcare choices. Much of this takes place in governmental health agencies and is funded through taxpayer dollars, although there are a variety of other settings in which we see public health practices. One part that's not discussed very often is end-of-life practice. But basically, these are services provided shortly before death. It includes hospice care, having a terminal diagnosis, and there are a variety of services and settings in which this can occur. But these are wraparound services, so not only end-of-life care, but also helping the family dealing with the grieving process, helping the patient come to terms with death and dying, helping take care of funeral expenses and things like that. These also, all of health insurance does include allied health professionals. And these are individuals that assist and complement the work of our doctors and other healthcare specialists. As you can see, some of the categories are laboratory technologists or technicians, therapeutic science practitioners, behavioral scientists, and other support services. For each of these different categories, the education and training varies depending on which specific category they're working in. When we look at public health professionals, again, they work in public health organizations, usually financed by tax dollars, but they're available to everyone. However, public health professionals primarily deal with economically disadvantaged populations. So to help those economically disadvantaged populations improve in terms of healthcare options. So again, our US system is very unique compared to other countries. We have the Affordable Care Act, which started in 2010. And the purpose of this was to extend healthcare coverage, to help curb healthcare insurance abuses, and ultimately improve the quality of healthcare in the United States. So our healthcare system is very complex. It is very expensive. And there's lots of people involved in healthcare decisions. As you can see from the triangle here, the three items are cost containment, so how to reduce costs, having access to healthcare, and quality. And it's important to make sure that all three of these are in balance, because if you expand access, then costs will go up. So then it reduces cost containment. It may also reduce quality. So it's really important when thinking about our healthcare coverage to look at all three of these items in the big picture. So insurance coverage and just having coverage are determinants of access to healthcare, which makes sense. If someone has health insurance, they're more likely to have access to healthcare facilities. In 2015, about 28 million US citizens are uninsured, which is about 9.1% of our population. While it seems like a high number, the good news is there have been improvements over the previous years. So since 2011, it's 11.5 million fewer uninsured compared to today. The likelihood of being uninsured generally tend to be greater for those that are young, as young people tend to not think about insurance as an expense that's necessary, as our health generally is better as when we are younger. Less education, lower income, non-white, and male. But the greatest reasons for lack of insurance, number one reason is the cost. Insurance is expensive, and it's often cost prohibitive for people to purchase health insurance, followed by job loss, as most of us get our insurance through our jobs, or a change in employment. There's also lack of access to primary care, and this may either be related to inadequate insurance or poverty. And so again, the major component of the Affordable Care Act is increasing the number of Americans with health insurance in the hopes that if you have health insurance, then you will utilize the health insurance to make sure that you are seeing your primary care physician and doing checkups and those sorts of items. So quality healthcare should be effective, it should be safe, it should be timely, so it should not take a lot of time from the time that you first see symptoms to the time that you're able to get an appointment with your physician or your nurse practitioner to the time that you're treated. It needs to be patient-centered, equitable, and efficient. When we think about the cost of health insurance and paying for healthcare, in the US in 2014, so this is already 6 years ago, health expenditures were about $3 trillion. That is such a great number. I can't even imagine what $3 trillion would look like. But the biggest part of our budget is spent on healthcare. And we spend the most on healthcare compared to the world. So the way that we pay for healthcare are either direct or out-of-pocket payments, third-party payments from private insurance, governmental insurance programs, or other third-party payers. So really, health insurance is a risk and and cost spreading process where the cost is shared by the group. It's generally equitable, but increased risk may lead to increased cost. So when we think about who pays for the healthcare burden, in the US, it's mostly paid for by employers and then the employee. So all workers have a share of the premium. And when healthcare goes up, there are ways that our prices go up as well. Could be raising our deductible. So how much do we have to pay out of pocket first before insurance kicks in? Increasing the prescription copayments. So how much do we pay each time we need to get a prescription refilled? And increasing the number of exclusions. So here are the items that are not included for our health insurance. There are three main programs that are provided by the government. It's Medicare, Medicaid, and the Children's Health Insurance Program, also known as CHIP. Medicare covers more than 55 million people. This is a federal health insurance program for those who are 65 or over, or have permanent kidney failure and certain disabilities. It's a contributory program that we pay through our FICA tax, and there are four parts. There's Part A, Part B, Part C, and Part D. Part A is mandatory. It does have a deductible and has co-insurance, meaning you're paying more upfront. For those who are enrolled in Part A are automatically enrolled in Part D, unless they decline. And this also has a deductible and co-insurance. Part C is offered by private insurance companies. It's not available in all parts of the US, and it does cost money. So you are paying a premium for those services. And Part D is optional. It's run by those insurance companies. And this mirrors what you would look like if you had private insurance, where you are paying monthly premiums. And it's kind of complex to navigate. Medicaid is a health insurance program for those with low income. There is no age requirement to be eligible for Medicaid. 68 million are covered by Medicaid. And this is determined state by state. So each state has their own eligibility requirements. And it's a budgeted item for states. So we think about the most popular insurance in the US as a managed care system, or HMO. And the goal is to reduce or at least control costs by controlling how people access and utilize their health care. Generally, people are assigned, or you choose your general health care practitioner. This is your primary doctor. And everything you need, you will first go to that doctor. So if you have, let's say, a broken foot, you would first see your doctor, who would then determine if you need to go see a specialist in orthopedics. With these providers, there are already pre-existing agreements between the insurance and the provider, and these agreements all have costs related to it. So how much would it cost for a general visit? How much does it cost for an emergency visit? And again, your primary care physician serves as a gatekeeper. So they're the one that will lead you to other specialists if it's needed. This will lead us to chapter 14, which is about the environment and then how that relates to our health. So obviously our health is related by the quality of the environment in which we live, and it includes the air we breathe, the water we drink, the food we eat, and the communities in which we live. There are regulatory measures which help address environmental assaults or issues with the environment in which we live in. And then we have to look at the two sides of the cone, environmental health versus environmental hazards. When we think about the air we breathe, there's a couple of components. There is the outdoor air pollution, the regulation of outdoor air pollution, our indoor air pollutants, and then protecting our indoor air. So outdoor air pollution is generally considered as contamination of the air that interferes with our comfort, our safety, and the health of all living organisms. In the US, the major sources of air pollution are transportation, electrical power plants that are fueled by oil, coal, and then just industry in general, so think of factories. And then we have primary pollutants and secondary pollutants. Secondary pollutants would be like photochemical smog versus industrial smog, ozone, and then thermal invasion. This is just a list of some of the pollutants of air. So you have carbon monoxide, lead, nitrogen dioxide, ground level ozone, particulate matter, and that could be either solid or liquid, and sulfur dioxide. When we think about the regulation of outdoor air quality, if you live in an area that has a lot of air pollution, they often put these air quality index levels to indicate what type of day it is. And it can go anywhere from good, which would be green, all the way to hazardous or maroon. If you live in an area that has high levels of air pollution, you would be very familiar with these numbers. I know California has these in their major areas, in the major cities. In the Chicago area, not so much. We generally are afforded good outdoor air. Indoor air pollutants can come from a variety of sources, and you can see those different sources here. And then second, in terms of the water we use, there are waterborne diseases. There's cholera, typhoid disease, dysentery, and it's responsible for over 1 million deaths worldwide each year. In 2010, 11% of the world population did not have access to clean drinking water. However, the good news is in the United States, 100% of our population has access to clean water and sanitation. Although not often. There are times when there are waterborne diseases that occur, but in the US, it's very rare. When we think about where we get our water, there are 3 main components. There's surface water, which are streams, rivers, lakes, reservoirs. We have our groundwater, which is located under surface of the ground. In the area where I live, we are groundwater, so all the houses in our area all have their own wells, and we pull our own water from those wells. And then there's aquifers, which are water-saturated layers of underground bedrock, sand, and gravel. And this can actually bring a significant amount of water. It's interesting is that the Earth's surface, the majority of the Earth's surface is water. However, the water that's accessible to humans is only 0.003%. We look at water pollution. So the definition is that it can include any physical or chemical change in water that can harm living organisms or make water unfit for other uses. There's point source pollution, and this is pollution that can be traced to a single source. So as you can see from the image here, you can see that black water coming from that pipe. That would be considered point source pollution. You would be able to follow that pipe to determine where that pollution is coming from. When we look at the other side, the non-point source pollution, this is pollution that occurs through like runoff or seepage or pollutants of water, where it's really difficult to determine where that pollutant is coming from. So it's non-point source, meaning we can't identify where it's coming from. In the US, we have one of the safest food supplies worldwide. However, there are more than 200 known diseases that can be transmitted through food, and there are several different points where food can be contaminated. A foodborne disease outbreak is when 2 or more cases of a similar illness resulting in ingestion of common food. And the symptoms can be anywhere from mild to very severe. And just some of the causes are inadequate cooking temperatures or improper holding temperatures. So after you've cooked the food, what's the temperature it's being held at? Unsanitary practices, mainly hand washing, or the second part is contaminated equipment, so cross-contamination. So where I cut my raw chicken, I should not then bring my fresh vegetables and cut on the same surface without first sanitizing it. And there have been a lot of federal, state, and local efforts to protect food. I know I was at Chipotle maybe a year ago, and they did not have romaine lettuce, and the romaine lettuce was contaminated with some sort of disease, and I don't remember exactly what the disease was. But as you can see here, is that this was a federal initiative is that they pulled all romaine lettuce off the market for a while until they were sure that what they were able to give contained no contaminants. So regulating food safety, it is regulated through our federal and state authorities. It's enforced by local registered environmental health specialists or sanitarians. And they come to businesses where there are food to measure temperature, look at their equipment, look at the sanitation practices. And also part of their job is consumer awareness. So I'm sure when you go to a burger house or a place that has steak, there's always a disclaimer at the bottom of the menu saying that, steak is not cooked all the way through, that there is a potential risk. When we look at solid and hazardous waste, solid waste is garbage, refuse, sludge, discarded solid materials. When we look at who contributes the most to solid waste, actually more than 95% is traced to agricultural, mining, gas and oil production, and industry, think of factories. And less than 5% is municipal solid waste, which comes from us. It's household, businesses, institutions within municipalities. Generally, each person creates about 4.4 pounds of waste per day, which in my household, I can definitely see. I feel like it would be a lot higher. I don't know why we have so much garbage in my household. But then there's also hazardous waste. So how do we manage our solid waste? There are a few ways that we try to do it in the US. One is source reduction, so to use less of it, recycling, composting, having sanitary landfills, and we also do combustion where we incinerate it or put it on fire. Another concern is lead, and lead often contaminates well water. In the past, lead was used in the piping, lead was used in paints, and it's when this starts to chip off is that when it becomes hazardous, that's in our air, or we're breathing it in, or it's in our water supply. Lead can be very dangerous, particularly for younger children. They're at the greatest risk for lead poisoning, and there are some serious consequences. If you recall, maybe 5 years ago, Flint, Michigan had a huge lead problem in their water. And so this was just an ad that was given after this became public. It's, what do we do about baths, right? So is it safe to wash our kids in baths in water that potentially has lead in it? And you can see here some of the advertisements that were handed out. And then we have controlling vector-borne diseases. And vector-borne diseases are when living organisms transmit communicable diseases. The picture here is of a tick. Lyme disease is the #1 vector-borne disease in the US. There's also, think about mosquitoes, not so much here in the US, but in other countries, you have mosquito-carried diseases. Malaria, rabies would be considered a vector-borne disease as well. And then we have our natural hazards. These are just natural phenomenons, natural disasters that cause injury, death, or disease. And then lastly, population growth. So as our population continues to grow, some say that we will not be able to maintain the quality of life and health that we have today because there will not be enough resources to handle the growing population. And there's been some that discuss the humane means of how do we limit population growth, and really considering the consequences of trying to limit population growth. When I think of China's one-child policy, if you had more than one child, you were heavily taxed, which then had families who only want one child. But what they didn't think about was that families that one child that they were allowed, they wanted boys. So at the time, lots of girls were given up for adoptions. There was a lot of sex-selected abortion. So if they found out they were having a girl, they would have an abortion. And ultimately, what this led to now is a population that has more men than women and not enough women for all the men. And this is just a chart of the world population growth in historical perspective and then future predictions. So you can see here, from 1750s, the growth was pretty low. But starting around 1950, the growth started going higher and higher and higher each decade or so. This is considered exponential growth, meaning that the upward trajectory is going to continue to go up. It's not going to level off. That concludes our weekly video. I hope you all have a wonderful week.